Mitochondrial disease is actually not that rare. There's quite a few families that are affected, both adults and children. And there needed to be a forum to increase awareness, a place where families could go to get information, to get comfort. And those are things that they get from other families, not necessarily from a medical clinic. And it was the family of one of my patients who were one of the early families that were important in starting Mito Canada. And what they've done to it has been amazing. I'm very impressed that the whole organization and a lot of other people have come together to achieve what they have. And it gives hope that there is research being done in the area, that there is fundraising being done for mitochondrial disease research, and we have benefited from that. We graduated the first PhD student from funding from Mito Canada and other research, and others have as well. And it's just a fabulous organization. I'm really happy to see what's happened here in Canada with the organization. And I think it offers that hope to families that attention is being paid to mitochondrial disease, and that maybe we'll get somewhere further with diagnosis and treatment than the way things were in the past. So we don't have a cure for mitochondrial disease. In fact, if you look at the numbers, children that are diagnosed with mitochondrial disease under 1 year of age have a low likelihood of making it to adulthood. And even in types of mitochondrial disease diagnosed in adults, their life expectancy is shortened. There's no magic cure or drug or transplant, nothing out there that you could consider to be disease modifying. What we have are a number of vitamins. We know exercise helps. So we have a lot of work to do to find out how we're going to improve the lives of these patients. And it's a group of diseases, it's not one disease. So even finding the answer to one disease doesn't mean it's going to work in the other groups of disease, mitochondrial diseases. And we're just at the beginning. There's a lot of work to do to find answers and cures. And the hope is that with research, it's really the only way we're going to make advances. The answers aren't going to come down to us from out of the blue. One of the things that the families have had difficulty with is being able to communicate with other families. Sometimes the type of mitochondrial disease will be very rare. And for clear reasons of patient confidentiality, we can't really exchange information between families as a medical clinic. But MitoNet gives an opportunity for them to have discussions amongst themselves and even amongst other professionals. There's lots of little things to sort out in life when you have a child or you yourself have a mitochondrial disease. And there's lots of resources that need to be accessed in the community. And this way, this sort of peer-to-peer network is going to facilitate people getting help for so many things that, you know, if you see the doctor or nurse every 6 months or 1 year, that's not enough exposure to get all your problems sorted out. So I think having this communication will be a big thing.